Hi, my name is Grace Quote. I'm here to talk to you about the Neurocritical Care Fellowship Program at USC. The USC Neurocritical Care Fellowship is 2 years in total, and there are 4 fellows across 2 years. The USC Keck University Medical Center is connected with the LA County Hospital, which is one of the largest county hospitals in Los Angeles. The Critical Care Fellowship takes place with rotations at both sites, so it's an interesting mix of the county population as well as the university more specialized cases that we get there. Being the fact that we get to train at 2 different sites, we get to see a really wide variety of pathologies that pertain to neurocritical care. At the LA County side, we get to see a lot more things like trauma cases, TBI cases, and of course the very bread and butter cases that we see in neurocritical care. Whereas at the university side, the Keck side, we get to take care of a lot of transfer patients, a good majority of vascular patients, as well as post-neurosurgical patients as well. In the morning, what we do is we come and we pre-round of all of our patients. We take care of any of the business from overnight and make sure any of our overnight transfers and admissions are doing well. Then we do imaging rounds with our attending. We have a multidisciplinary round with physical therapists, occupational therapists, and case managers so that we really provide all our patients with a comprehensive care, both their medical needs, their social needs, and also what needs their family might have as well. And then we round, and then we take care of our patients, whatever it is, being if they need to have their medications adjusted, if they might need a procedure or anything like that, we're there for everything. Our fellowship program is great because our fellows get to be hands-on in everything really. Our attendings are very supportive of us to gain experience in all kinds of procedures, even really specialized ones like EVDs, which traditionally is a neurosurgical procedure, but for a neurointensivist to have that skill in the real world, it's very helpful, and it makes you a commodity for the neurosurgery for your colleagues because they know that if they're in a pinch and can't get out of the OR and there's an acute admission that might need a EVD, the neurointensivist can be there and can be reliably putting in the EVD ourselves. After training, one day we all have to go out in the real world and get real jobs and everything like that. But having some of these specialized skills that we get to train for here at USC, it makes us more marketable when we're getting jobs out there, and not just in the neuro ICU, because our fellowship program is spread across. We do rotations also in MICU, in SICU, in the trauma ICU, and the cardiothoracic ICU. We have really good experience across the board, so we could work in any type of ICU setting really. There's a lot of additional things other than the great training that we already talked about. So one of the great things is that the academics at this program is also really excellent. All of our attendings have a broad range of research interests. There are some attendings who are interested in bench research. There's some attendings who like clinical research and transitional research, and some are interested in admin and QI type research. So anything that you're interested in and anything that you wanted to add to your skill set, there's somebody here to help you support that and to go after that. And then the other thing is I love the people here. Everybody has been very supportive of me, from both my co-fellows, from the MPs who are on our team, my attendings, and then also we have a great relationship with the neurosurgery program here on every level. The attendings are all very collegial with each other, so that trickles down to the residents and the fellows, as well as our MPs as well. It's really a big team and a big family here that we're all just working to the same goal of trying to take good care of our patients. The wet lab is great, especially when we're first starting out like myself, because we're learning all these procedures that we really didn't get to do much in residency. So it's great to have some practice and just to practice some of the skills. Obviously doing it on the patients is eventually what's going to help us become skillful at it, but just making sure that we have the flow of what we're doing down in the wet lab is really good, and we get to practice all the procedures like the EVDs, the intubations and lines. We get to practice all of that in the wet lab, so that's also another really big benefit for us. Learning how to maneuver the mouth and the airway and how to bag patients well with the kind of ventilator bag like we see on the TV, more dramatic type stuff. So we get to do all of that in the cadaver lab first, which is the wet lab, and then hopefully we practice those skills well enough that it becomes muscle memory when we have a real patient in a more acute situation. I grew up in Southern California. I went to school all over the United States before I decided to come back here for my training. And it's a great place to live in that there's hiking, there's beach, the weather is great, so you never have to worry about not being able to get to work in the winter because it's snowing. I've had that happen. So that's the benefit. And this fellowship program is very rigorous, but at the same time it's great because they really do care about our wellness, and they do want us to have time to rest and enjoy things in life that we enjoy. And California is a great place for you to look up, find new hobbies, continue your old hobbies, anything like that you want to do. All the attendings here are very supportive of my goals, and they're always asking me how I'm feeling, what contacts I need, what other experience that I think I need to get. And so I've always felt very, very supported here, and very much like everybody here cares about my well-being and my future too, and my professional goals.
Once you've done a residency or a fellowship here, you are ready for the next phase of your career. And that might be going into clinical practice, it might be going into academia, it might be going on for more training. Whatever it is, be assured that you are going to be the most well-prepared person possible for that next part of your career.